Foreskin removal, also known as circumcision, has been a topic of discussion and debate among medical professionals for many years. The procedure involves surgically removing the foreskin, which is the fold of skin that covers the head of the penis. From a medical perspective, circumcision is considered a relatively simple and low-risk procedure, but it is not without its potential complications and controversies. Circumcision has been performed for thousands of years, with evidence of the practice dating back to ancient civilizations in Egypt, Greece, and Rome. In modern times, the procedure is often performed for religious or cultural reasons, as well as for medical reasons such as treating conditions like phimosis, where the foreskin is too tight to retract over the head of the penis. The American Academy of Pediatrics recommends that circumcision be considered as an option for newborn males, as it has been shown to have several health benefits, including reducing the risk of urinary tract infections and penile cancer. One of the primary medical benefits of circumcision is the reduction of urinary tract infections in infants. Studies have shown that circumcised males have a significantly lower risk of developing urinary tract infections, which can be serious and even life-threatening in some cases. Additionally, circumcision has been shown to reduce the risk of penile cancer, as well as other conditions such as balanitis and balanoposthitis, which are inflammatory conditions that affect the penis. Circumcision also has been shown to have benefits in terms of reducing the transmission of sexually transmitted infections, including HIV. Studies have demonstrated that circumcised males are less likely to contract HIV and other sexually transmitted infections, such as herpes and syphilis, than uncircumcised males. This is thought to be due to the fact that the foreskin provides a warm, moist environment that is conducive to the growth of bacteria and other microorganisms, which can increase the risk of infection. Despite these benefits, circumcision is not without its potential complications. The most common complications of circumcision include bleeding, infection, and damage to the penis or surrounding tissues. In rare cases, more serious complications can occur, such as amputation of the penis or death. However, these complications are extremely rare and are often the result of improper technique or aftercare. In recent years, there has been an increasing trend towards delaying or avoiding circumcision in newborn males. Some parents and medical professionals argue that circumcision is an unnecessary and potentially harmful procedure that can cause pain, trauma, and long-term psychological damage to the child. Others argue that the benefits of circumcision do not outweigh the risks and that the procedure should only be performed for medical reasons, such as treating conditions like phimosis. The debate over circumcision has also been influenced by cultural and social factors. In some cultures, circumcision is seen as a necessary and desirable procedure, while in others it is viewed as unnecessary and even barbaric. The American Academy of Pediatrics has taken a neutral stance on the issue, recommending that parents be informed of the potential benefits and risks of circumcision and that the decision to circumcise or not be made on a case-by-case basis. From a medical perspective, the decision to perform circumcision should be based on the individual needs and circumstances of the patient. In cases where circumcision is deemed medically necessary, the procedure should be performed by a qualified medical professional using proper technique and aftercare. In cases where circumcision is not medically necessary, the decision to perform the procedure should be made on a case-by-case basis, taking into account the potential benefits and risks, as well as the cultural and social factors that may influence the decision. In terms of the technical aspects of circumcision, the procedure typically involves surgically removing the foreskin, either partially or completely, depending on the desired outcome. The procedure can be performed using a variety of techniques, including the use of a scalpel, scissors, or a specialized device designed specifically for circumcision. The choice of technique will depend on the individual circumstances of the patient, as well as the preference of the medical professional performing the procedure. Aftercare is an important aspect of circumcision, as it can help to reduce the risk of complications and promote healing. This typically involves keeping the area clean and dry, applying topical antibiotics to reduce the risk of infection, and avoiding strenuous activities or tight clothing that can irritate the area. In some cases, pain medication may be prescribed to help manage discomfort or pain during the recovery period. In addition to the technical aspects of circumcision, there are also a number of emotional and psychological factors that should be considered. The decision to perform circumcision can be a difficult and emotional one, particularly for parents who are considering the procedure for the newborn child. It is essential that parents be fully informed of the potential benefits and risks of circumcision, as well as the cultural and social factors that may influence the decision. The long-term effects of circumcision are also an important consideration. Some studies have suggested that circumcision can have a negative impact on sexual function and sensitivity, although these findings are not universally accepted and more research is needed to fully understand the potential long-term effects of the procedure. Additionally, there is some evidence to suggest that circumcision can have a positive impact on mental health and well-being, particularly in terms of reducing anxiety and stress related to genital health. In conclusion, foreskin removal, or circumcision, is a complex and multifaceted issue that has been debated by medical professionals for many years. While the procedure has several potential benefits, including reducing the risk of urinary tract infections and penile cancer, it is not without its potential complications and controversies. The decision to perform circumcision should be based on the individual needs and circumstances of the patient, taking into account the potential benefits and risks, as well as the cultural and social factors that may influence the decision. Ultimately, it is essential that parents and medical professionals be fully informed of the potential benefits and risks of circumcision, and that the decision to perform the procedure be made on a case-by-case basis. Foreskin removal, also known as circumcision, has been a topic of discussion and debate across various religious perspectives for centuries. The practice of removing the foreskin, which is the fold of skin that covers the head of the penis, is considered a significant ritual in some religions, while in others it is viewed as a medical procedure or a personal choice. In this speech, we will delve into the different religious perspectives on foreskin removal, exploring the historical, cultural, and theological contexts that have shaped the attitudes and practices of various faith communities. In Judaism, circumcision is considered a fundamental aspect of the covenant between God and the Jewish people. The practice of Brit Milah, or ritual circumcision, is performed on the 8th day after birth and is seen as a sign of the covenant between God and the Jewish people. The removal of the foreskin is believed to symbolize the removal of impurity and the dedication of the individual to God's covenant. The Torah, the central text of Judaism, contains several references to circumcision, including the commandment in Genesis to circumcise all male infants on the 8th day after birth. In addition to its theological significance, circumcision has also played a significant role in Jewish culture and identity. Throughout history, Jewish communities have maintained the practice of circumcision as a way of distinguishing themselves from other cultures and affirming their connection to the Jewish tradition. Today, circumcision remains an essential part of Jewish life, with many Jewish families continuing to observe the ritual as a way of welcoming their sons into the covenant. In Islam, circumcision is also considered a significant practice, although its significance and timing vary from Judaism. In Islamic tradition, circumcision is seen as a sunnah, or a recommended practice, rather than a compulsory one. The Prophet Muhammad is believed to have been circumcised, and many Muslims follow his example as a way of emulating his actions and demonstrating the devotion to God. The age at which circumcision is performed varies among different Muslim cultures, with some performing it in infancy, while others wait until the child is older. In Islamic theology, circumcision is seen as a way of purifying the individual and removing impurities. The practice is also associated with the concept of fitra, or the natural state of humanity, which is believed to be characterized by purity and innocence. By removing the foreskin, Muslims believe that they are restoring the individual to their natural state and preparing them for a life of spiritual growth and development. In Christianity, the practice of circumcision is more complex and nuanced. The New Testament contains several references to circumcision, including the statement in Galatians that, in Christ Jesus neither circumcision nor uncircumcision counts for anything. This verse, along with others, has led many Christians to conclude that circumcision is no longer a necessary or significant practice. However, some Christian denominations, such as the Coptic Orthodox Church, continue to practice circumcision as a way of affirming their connection to the Jewish roots of Christianity. In Hinduism, the practice of circumcision is not universally accepted and is viewed as a personal choice rather than a religious requirement. Some Hindu communities, particularly those in South India, have traditionally practiced circumcision as a way of promoting hygiene and preventing disease. However, the practice is not widespread and is not considered a significant aspect of Hindu theology or culture. In Buddhism, the practice of circumcision is also not universally accepted and is viewed as a personal choice rather than a religious requirement. Some Buddhist communities, particularly those in Southeast Asia, have traditionally practiced circumcision as a way of promoting hygiene and preventing disease. However, the practice is not widespread and is not considered a significant aspect of Buddhist theology or culture. In many African and indigenous cultures, circumcision is an important rite of passage that marks the transition from childhood to adulthood. The practice is often performed as part of a larger initiation ritual, which may include other physical and spiritual challenges. In these cultures, circumcision is seen as a way of testing the individual's courage and endurance, as well as preparing them for their future roles and responsibilities. In some cultures, circumcision is also associated with spiritual and mystical experiences. For example, in some indigenous cultures, circumcision is believed to allow the individual to communicate with the spirit world and access other realms of consciousness. In these cultures, the practice of circumcision is often accompanied by rituals and ceremonies that are designed to facilitate spiritual growth and transformation. Despite the significant cultural and religious differences surrounding circumcision, the practice has also been the subject of controversy and debate. Some critics argue that circumcision is a form of genital mutilation that can cause physical and emotional harm to the individual. Others argue that the practice is a form of cultural or religious imperialism, in which one culture or religion seeks to impose its values and practices on others. In recent years, the debate over circumcision has become increasingly polarized, with some advocates arguing that the practice is essential for promoting public health and preventing disease. Others argue that the practice is unnecessary and that alternative methods, such as vaccination and education, are more effective in promoting public health. In conclusion, the practice of foreskin removal, or circumcision, is a complex and multifaceted issue that has been shaped by a wide range of cultural, religious, and historical factors. While some religions and cultures view circumcision as a significant and essential practice, others see it as a personal choice or a medical procedure. As we consider the different perspectives on circumcision, it is essential to approach the topic with sensitivity, respect, and an open mind, recognizing the diversity of human experience and the complexity of the issues involved. The significance of circumcision in different cultures and religions is a reflection of the diversity and richness of human experience. Whether viewed as a religious requirement, a cultural practice, or a personal choice, circumcision remains an important and complex issue that continues to shape the lives and identities of individuals and communities around the world. As we navigate the complexities of this issue, it is essential to prioritize respect, empathy, and understanding, recognizing the many different perspectives and experiences that shape our global community. Ultimately, the practice of circumcision is a reminder of the importance of cultural and religious diversity, as well as the need for ongoing dialogue and education. By engaging with the different perspectives and experiences surrounding circumcision, we can deepen our understanding of the complex issues involved and work towards a more inclusive and compassionate world. The many different perspectives on circumcision are a testament to the richness and diversity of human culture, and it is essential to approach this issue with sensitivity, respect, and an open mind. The cultural and religious significance of circumcision is a reflection of the many different ways in which human societies have sought to understand and connect with the world around them. Whether viewed as a spiritual practice, a cultural ritual, or a medical procedure, circumcision remains an important and complex issue that continues to shape the lives and identities of individuals and communities around the world. As we consider the different perspectives on circumcision, it is essential to prioritize respect, empathy, and understanding, recognizing the many different experiences and cultures that shape our global community. The practice of circumcision is a reminder of the importance of respecting and valuing the diversity of human experience. Whether viewed as a significant religious practice, a cultural tradition, or a personal choice, circumcision remains an important issue that continues to shape the lives and identities of individuals and communities around the world. As we navigate the complexities of this issue, it is essential to prioritize dialogue, education, and understanding, recognizing the many different perspectives and experiences that shape our global community. In the end, the significance of circumcision is a reflection of the many different ways in which human societies have sought to understand and connect with the world around them. Whether viewed as a spiritual practice, a cultural ritual, or a medical procedure, circumcision remains an important and complex issue that continues to shape the lives and identities of individuals and communities around the world. As we consider the different perspectives on circumcision, it is essential to approach the topic with sensitivity, respect, and an open mind, recognizing the diversity of human experience and the complexity of the issues involved.